Good morning. Welcome and thank you for joining us for week 12 of our Northern Light Health Business to Business Zoom conference. Today we are going to talk about the much anticipated new school year, which brings with it so many new challenges, demands, and worries, and highlights the need for more self-care. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I will be your moderator for the next hour. Schools all over the state are welcoming back their students in the coming days, either in person, online, or a combination of both. Parents, educators, employees, and business owners are all trying to figure out how to balance their schedules while supporting the needs of children. We have so much to talk about today, and we have welcomed back 4 Northern Light Health experts to help us. Our panelists today include Chris McLaughlin, a licensed clinical social worker and Associate Vice President of Community and Pediatric Services at Northern Light Acadia Hospital. Suzanne Mooreshead, a registered nurse and the Infection Control Specialist for Northern Light Health. Yamaya St. Clair, a nationally certified counselor for Workforce, which is a Northern Light Health organization offering employee assistance programming, training, and other consultative services. And Dr. Jim Jarvis, the Senior Physician Executive and Director of Clinical Education at Northern Light Eastern Maine Medical Center. Dr. Jarvis also serves as the COVID-19 Response Incident Commander. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I will track the questions and ask our speakers to respond following today's presentations. Also, to help us get a little more detail on how we can best support your efforts, we will be emailing a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in us focusing on in the future. So let's get started. Our first panelist this morning will be Chris McLaughlin. Chris, thank you for joining us again today. Wearing my working mom hat, I think I can speak for many parents when I say that this school year is more stressful compared to any other. What recommendations do you have to help us juggle all the challenges COVID-19 has presented us with so that we can better support our children?
Hi, Karen. Good morning, and good morning to everyone joining us. Thanks for having me back with you again. So when I think about where we've been and I think about where we're going, this image of the 8-armed octopus, very busy 8-armed octopus comes to mind, where really it's been about juggling and trying to multitask and manage the many, many demands for parents and for families that have come their way. There's so much going on virtually right now. And as we think about the school year ahead of us, and for some people listening, that school year may have already started, this idea of already feeling overwhelmed and stressed really, really comes to mind. And what I like to often just say to families and even coworkers and other colleagues is to make sure that when you're taking all those arms and you're juggling all those tasks, please make sure that you're taking some time to pat yourself on the back with one of those arms, because really it's about celebrating the success and the mountains that you have moved over the course of the spring and summer. And we're coming into the school year with a little bit more miles of this coronavirus marathon under our belt and with the miles on our shoes. So really it comes down to self-care. It's a topic that we've been talking a lot about. And I'm here to say that this is not your parents' or grandparents' self-care. This is not the same kind of self-care that we've been talking about as social workers and behavioral health experts for years and years. It really is a new concept that we have to start thinking about how we microdose our self-care over the course of every day, all week long, weekends. And so what I've done here is just thought through some really effective and efficient and inexpensive ways that individuals of all ages can engage in some kind of kindness or gentleness to yourself. Because what it comes down to is that self-care is much, much more than manicures and pedicures. It's bigger than massages and trips to the tropics and even binging on chocolate and wine and ice cream and pizza. Self-care right now has got to be about building a plan and maximizing the way that we think about taking care of ourselves, being intentional about doing small but frequent, again, microdoses of self-care, small and frequent ways to just take care of ourselves. So I think about building a self-care plan. And this is an exercise that we do with new social workers and new staff coming on board here at Northern Light Acadia Hospital. And we talk about what does a self-care plan need to look like? What are the periods of time that self-care is most essential for those of us, whether we're managing with our families and kids and thinking about back to school, or our own jobs and our own careers and those other things that we're juggling. And so I think about what can be done before an encounter starts, and that's parking your car in the morning, getting ready to send your kid off on the bus, or even before turning on your computer for that first Zoom meeting or remote education class of the day. What can you do during those times? And of course, what's appropriate to do during the encounter for self-care may look very different than what you do before or immediately after, once that encounter is done. And then what's our commitment to ongoing self-care? What are those skills that we can integrate into our week, our months, our year that we can commit to over time? So to model this for you, I've built my own self-care plan, and here are some of the things that I've found work for me. So as I'm preparing for an encounter, whether it's getting ready to present to a large group of people, or whether it's coming into the office, parking my car, and just thinking about my day, 10 seconds of deep, intentional, deliberate breathing is really helpful just to, again, think about grounding myself and starting to build my self-talk, starting to get myself into the mode. So what is that pep talk I give myself where I congratulate myself for making it, for getting up and getting feet on the ground and thinking about what's ahead of me and again, prepping myself, pepping myself up. And then during, things that I find during encounters that work well for me are chair pushes or palm pushes, ways to discharge a little bit of tension that isn't noticeable to others around me, but I'm doing it myself and taking care, or grabbing my favorite beverage, whether it's hot tea or a full mug of ice cold water, and making sure that I'm refreshing myself, staying hydrated, and just paying attention to my body needs. My favorite part of self-care plan is immediately after, and this is where, when the encounter is done, I can turn up the soundtrack of my favorite Broadway show, Hamilton, right now. I can blast Hamilton and do some carpool karaoke and really just have some fun and let again some of that tension wash over me. And then also go for a walk, even if it's as quick as grabbing the mail or getting the empty trash bins from the end of the driveway, but just a way to get my body moving so I'm not going from one task immediately to the next without a break. And then also what I found to be super important right now is the ongoing self-care. What are my commitments? How am I structuring my weekends so that I'm not overcommitting, that I make sure I've got time to save for myself or my family and friends? Or looking at who's in my bubble and planning one fun activity to do, whether it's a dinner party or going out to the drive-in or finding a way to get out of the house and enjoy the social time with others that are in my bubble in a safe and appropriate way. I'm also thinking a lot and talking a lot about strategies for keeping kids engaged during these times of remote learning. And it's a challenge with Zoom and hybrid and trying to balance all of it out. And again, I want to say it's about building on the success of the spring, taking what you've already learned and how you've grown as a family and as a caregiver and as an educator in providing this education, and taking what already has worked and evolving it. So finding opportunities for choice, making sure that kids know when it's appropriate to have cameras on or cameras off, making it fun with backgrounds and filter effects and fun costumes, kids being able to bring some show and tell into their Zoom classroom, ways to keep them just laughing and having fun. And as educators and families, making sure we're seeking some real-time feedback using the chat box, using poll features or the thumbs up or other emojis. It's important to work with kids on the front end of Zoom learning so that there's a virtual plan on how they're going to ask for help. Oftentimes, kids struggle, even in a live classroom, to raise their hand and to say, Mr. and Mrs. So-and-so, I need more help with this. I don't understand that question. That might be even more challenging to do on Zoom. So what's the plan for kids to ask for help, whether it's a private chat, a private email, or a nonverbal signal that they can give you as a teacher? Integrating breaks, kids of all ages get the wiggles. Wiggles are not just for elementary school age kids. Adolescents need to move as well. And so we've got to think about how we integrate breaks, kid yoga, mindfulness, or ways to just get moving and get those wiggles out. Healthy snacks and good hydration nearby to cut down on trips back and forth to the kitchen or the refrigerator, making sure that just as a kid comes to school prepared to learn, they're prepared to learn at their remote setting as well when they're sitting at that dining room table. Here at Northern Light Acadia Hospital, I work with a lot of occupational therapists, and I've learned so much from them. One of my favorite strategies I've learned over the years is that sugar-free gum and sour hard candy can really provide a great sensory break for kids who may be struggling with concentration or some of those wiggles. And so just having that nearby to pop in their mouth and get that burst of flavor, which may help bring them back into focus. And then finally, for teachers and families, I really want to stress that it's also so important to be mindful of a kid and sometimes families' need for privacy. That oftentimes kids who are already victimized and are already being bullied by peers don't necessarily want to share their home life on camera with their peers. And maybe they're embarrassed about the status of their home or the family members that they're living with or some of the behaviors going on at home. So we've got to make sure that we're mindful of privacy and that we're paying attention to safety. Remote safety planning is so important right now, especially in times where we know that calls to domestic violence hotlines are up and reports of child and abuse and neglect are down, but the severity of abuse and neglect being seen at level 1 trauma centers are much higher and more significant over the whole country. And so we've got to make sure that we've got safety and privacy in the forefront of our minds. So we're talking a lot about masks, and I know this is a huge issue for schools right out of the gate. And so I like to share some of these strategies that I've clustered into what I call the 3 Ps. It's really all about practicing, pretending, and playing. And so finding a way to make sure that kids know the mask style and shape and material that is most comfortable and effective for them. Not every child is going to be able to do well in the paper disposable masks, and they may need the familiar material of a old blanket or old t-shirt or pajamas that a craft project mask might be able to help engage some cooperation with them. And I'm really hopeful that there's been some practicing over the last couple weeks to build some tolerance up with different lengths of time of wearing those masks. So important right now. Pretending, dressing up as doctors or nurses or veterinarians or getting those masks on stuffed animals, and 2 words, fashion show, getting kids walking down the hallway, making your own red carpet or your own step and repeat wall so kids can show off the fun masks that they've created or collected over the course of the summer or as school is getting right in to into session. And you as adults and caregivers and families can also really participate in a fun fashion show. And then with playing, start taking some pictures of those fashion shows and selfies. Ask family members from all over the country and friends to send selfies of them in masks as well. And keep having fun, keep playing with masks. Get the dog in a mask, get the family portraits on the wall with mini masks or kid action figures or Legos. My pro tip around masking compliance right now is exposure is everything. Keep masks everywhere and anywhere kid eyes are going to be. On the kitchen table, on the coffee table in the living room, on the nightstand, in the car, and just make sure that kids are seeing masks all around them. If the mask is something that you pull crumpled out of your purse or your back pocket and grumble about as we're putting it on, it's not going to surprise us when we see kids struggling with cooperation with masks as well. The other topic that's hot on everyone's mind right now is certainly around physical distancing. How are we going to make sure that we are not fighting this battle constantly as school comes into session and kids who might not have seen each other since March are greeting each other in person for the first time? And so right out of the gate, we've got to think about how we design our classrooms and our playgrounds and auditoriums and gymnasiums to make sure that we've got some good ideas for keeping kids physically distant. My first suggestion is an X mark the spot. Think of a treasure map and think about maybe putting some of that sugar-free gum or hard candy strategically located around the X's so that there's a little bit of reinforcement for younger kids to be on that X. Or a game like tic-tac-toe that kids of every age just know. I've worked with kids for so long and it's almost impossible for a kid to walk across a hopscotch board without hopping and scotching. Same, I think, with a tic-tac-toe board, creating a larger than life tic-tac-toe design where kids can just naturally find themselves standing on both X's and O's and having a little bit of fun while they're standing apart. Other visual reminders like a hula hoop thrown on the grass or on the floor. Hula hoops are great to be able to quickly disinfect, and they're so portable and able to move around wherever you need and create that kid's physical bubble for them. Another physical reminder are chairs, lightweight camp chairs that are easy to take out and break down. As humans, when we're standing in a circle, we just tend to gravitate towards one another and we start to want to cluster closer. Chairs set up will help decrease that tendency to drift closer. I also want to give some suggestions for games and activities that can happen outdoors and by definition are meant to be socially distanced. It's very hard to play Frisbee when you're less than 6 feet from each other. And so again, a Frisbee is really an easy piece of sporting equipment to wipe down and disinfect. And it forces kids to be separate from one another to play, as is a scavenger hunt, a way to get kids outdoors moving around and spread out all over the school grounds. Here you're seeing an example of a rainbow scavenger hunt where kids need to find something of every color and bring that back. Kids can work independently or in teams and get some of that teamwork going while still dividing and conquering their list, seeing how many on the team can complete the Roy G. Biv challenge. And as I said, this is going to be a challenging time where kids are coming into the building and haven't seen each other for a very long time. So we've got to think about quickly coming up with nice socially distant greetings that we can encourage kids to do, whether it's an air high five or an air heart, crossing your heart, tugging an ear, pointing at your nose, or I challenge homeroom teachers to come up with a homeroom greeting that's unique for them. A couple claps, maybe a head tilt and an arm raise, but any way that kids can feel like they're part of something larger that's unique for them and still maintaining social distance. And again, my pro tip here, modeling is everything. Kids do what they see done around them. So the best way to engage youth to do these things is for us to model this as well. So to make sure that the teacher's room and staff meetings, places where kids may see teachers gathered, we're also abiding by the same masking and social distance guidelines as well.
Thank you so much, Chris. There's so many takeaways from your presentation, and I look forward to playing in the coming weeks and months. Next, I would like to introduce Suzanne Mooreshead. Suzanne, you've joined us several times and always with positivity and new information to guide us on how to stay safe. What's the latest on infection control, knowing the school year is just around the corner?
Thank you for having me back. As everything with COVID, it is constantly evolving. And as schools and businesses reopen and communities are adjusting to life with COVID, the questions that I've received as an infection preventionist have certainly evolved. No longer are they, do we need to socially distance or mask? I think we've all pretty much determined we need to do that. But how do we effectively distance? What types of masks are better? Are there new ones out there? Are there some that we shouldn't be using? And the questions are also becoming a little bit more complex. No longer are we asking the theoretical, well, what if somebody gets sick around me? It's more of, okay, what am I really going to do when this happens, not necessarily the if. What I'm going to do is share some of the most common questions that I'm currently being asked and what my responses are. And again, this is evolving. So my answers today may be a little bit different as we learn more about COVID down the months. But as of right now, these are best practices. And I hope that this is, as I go through some of these questions, I hope that this will start all of you thinking about additional questions to ask. So that way, at the end of this, we can have a more robust conversation about what's concerning each of you right now. So a vast majority of my questions are really around masking. What type of masks should we be using? Which ones are the most effective? And quite honestly, the majority of masks that are out there are really quite effective. The purpose of the mask, when you get right down to it, is really to slow or stop the spread of the droplets from the person that's wearing it. So anything that's going over the face and the nose and mouth specifically are really quite effective. There have been quite a bit of questions regarding gaiters. There was a study in the media not that long ago and that kind of alluded to the fact that gaiters may not be the most effective. They still are. I wouldn't take them off the list of what could be used within your facilities and your schools. And that's simply because the media reported on a study that was really about how to measure the effectiveness of a type of face covering, not necessarily are these effective. So it was really about the measurement process and not the effectiveness of a particular type of face covering. Now, that said, there are some face coverings that you just shouldn't let be used within any of your schools. And these are ones that allow the breath, the droplets, the cough, the sneeze of the wearer to escape. So these are the ones that you see with valves on the front. A lot of times these are very similar to what construction workers use. Those really don't filter out the particles from the wearer. As COVID has kind of moved on, people have gotten very creative. So there's some very creative masks that are out there. And in the creativity, some masks are more mesh-like. I would really avoid those. I've actually seen some pictures of people wearing chainmail type masks. Again, when you just simply look at it with some common sense, it makes, they certainly are not the effective type of mask that you should be using. It's really far more important that the masks or the face coverings that are used within your facility are used correctly. So again, covering the nose, covering the mouth. And to tie into what Chris just said, I love his idea of games and play around masks. There's also, if you play a game with your students in terms of not just, putting the mask on a doll, but playing with the mask, putting it on the top of the head, making a mask crown or beard, and asking the students in your class, is this acceptable? Is this good mask wearing? Sometimes those games certainly will help in making mask wearing a little bit more effective. Another question that I get quite often goes back to socially distancing, again, something that Chris just mentioned. And cohorting, which I know most of the schools are looking at different varieties of cohorting, is a really great strategy. And that's just simply taking those larger groups and breaking them down into smaller groups. And what that does is that just allows, if there's a positive student or staff member within that group that contracts COVID, it's a smaller group of people that are potentially exposed. And as I know, a lot of schools are doing this at the school level, but it's also something that can happen in smaller groups. So if you have groups within the classroom that naturally work together, keep those groups together so that way if one in that smaller group gets sick, it's an even smaller group that are those potentially exposed people. Now, I do have one suggestion. I've seen and heard of some school plans where they've divided the school into, say, 2 cohorts. Half the school comes in one day, the other half the other day. And usually during the middle of the week, they take a day off to clean. My suggestion on that would be keep the cohort together if there's a cleaning day in the middle. So say you have cohort A, they're there Monday and Tuesday, Wednesday is the cleaning day, and then have cohort B come in for those second 2 days in the week, if that's possible within your school district. And again, what that does is it just helps keep that close contact and potential exposure and surface cleaning a little contained to a smaller group. Now, in terms of what is a contact, when I should be concerned, what is contact tracing? By definition, a contact is another individual being within 6 feet for more than 15 minutes without either individual wearing a face mask or face covering. So as a teacher, it's really helpful to keep an eye on the groups that are in contact within your supervision. And if it's within the same group, you get to know which ones are kind of the good mask wearers, which ones do tend to wear them as a crown, or they kind of pull them down and they wear them as a beard. And as you start to really look at who's part of that group, if somebody does get that virus that causes COVID, it will help you with the questions that the state's going to ask in terms of contact tracing. Now, the school itself isn't going to have to do the actual contact tracing, but they're going to be called by somebody at the state level that's going to ask who are all of the other individuals that have met the definition of a contact. So again, that person that's been within 6 feet, more than 15 minutes without them, both of them wearing a mask. You're going to have that information handy, so you'll be able to get that information back to them. The sooner contact tracing can happen, the faster and easier it is to help keep that type of COVID spread contained to a smaller group. Again, these are just some of the more common questions that I'm getting right now. I look forward to hearing your questions at the end of this. Thanks.
Thank you. Thank you so much, Suzanne, and thank you. The information you shared is very informative, but as a mom, I particularly appreciate hearing more about the face coverings because it has been quite confusing for many of us to navigate. Next, I'd like to introduce Umaya St. Clair. Umaya, many people of all ages will be wearing masks for hours each day, and this is certainly new for many of us. What advice do you have, and what does self-care look like during these times?
Well, thank you so much. I don't know about you all, but it's taken our family longer than I care to admit to develop good masking habits. Hanging clean masks by the door, reminding each other to bring them wherever we go, storing extras in our glove box, and having a place to put masks when they're dirty. This is really our new reality. And of course, for some employees and customers and students, adjusting to near universal masking is really going to be hard. Some find facial coverings hot, uncomfortable, unattractive, or inconvenient. Others don't like how they inhibit communication. Some feel claustrophobic or anxious wearing a mask. And of course, there's those who just don't like being told what to wear. So we know masks are effective, and we have to help people who are resistant to wearing masks cope and comply. So some tips. And this has been brought up earlier in the presentation, the importance of modeling, right? We can model the behaviors and attitudes around masking that we want others to follow. We can stay positive, focusing on the altruistic reasons for masking. When we wear masks and have a good attitude about it, we're demonstrating how really doable it is. And second, we can make it as easy as possible for people to comply. You're going to want to clearly articulate your safety protocols wherever you can, on your website, in your communications, and especially in your signage outside and inside your establishment. People often need to hear and see things multiple times in multiple different formats before they really understand it. And if people don't have a mask, just assume they forgot it that day and have some free ones readily available if possible. This leads me really to my next point about let's all try to give each other the benefit of the doubt. If someone enters your establishment without a mask, try not to make assumptions. I have a quick story here, right? The first time I went into the grocery store after they'd implemented those one-way aisles, I completely overlooked the arrows and signage. I was so focused on getting what I needed and getting out of there as soon as possible. Of course, every other aisle I went down, people were staring at me, glaring at me, which just made me more flustered. So then I forgot things on my list and had to circle back, again, getting really nasty looks. Of course, I did finally notice the signs and felt like a real idiot. So is there a way that the store could have better caught my attention? Maybe, but customers are also going to make honest mistakes, and we need to give people the benefit of the doubt and help them comply. If someone in the store had calmly and kindly oriented me to the new protocol, I happily would have complied sooner. So let's all try to do that for each other. We also need to acknowledge that some people are going to be truly resistant to wearing a mask. When someone complains about your safety protocols, it's okay to say something like, I get it, this is not ideal. People need acknowledgement and need to feel that their concerns and challenges are really heard and validated before they're willing to listen and comply. Then, once you've acknowledged someone's concern, calmly and gently reiterate your safety protocol. Here, tone and body language really matter. Avoid overreacting and really practice kind of this rational detachment, or in other words, just not taking someone's behaviors or comments personally. This is a lot harder than it sounds, I know. Particularly when we're faced with someone who is angry or mean, it's really hard not to engage, even when we know that doing so will just add fuel to the fire. So I encourage everyone to really practice, right? Anticipate points of conflict and role play them. So here's an example of how someone might be trained to respond. You've determined that the front desk staff are responsible for enforcing masking, as an example. So a man enters, his face is not covered, and Joe, who works at the front desk, he's been trained to handle this. So he feels confident and calm. He says, "Hi, thanks for being here. In order to keep everyone safe, everyone needs to wear a mask. If you don't have your own, we have free disposable masks here for you." If the customer pushes back saying, "Hey, I just got tested, I'm not sick, I don't want to wear a mask," and continues to approach, Joe's got this. He responds saying, "It's inconvenient, I know, but we all have to wear face masks in order to be here. Please put on a mask." If again the customer refuses, Joe would then say something like, "I'm sorry, but I'm going to have to ask you to leave. You're welcome to come back another time when you're wearing a mask." Many employees are finding this new part of their job really difficult. They likely didn't apply for this position knowing they'd be enforcing mask protocols. They probably need more empathy, more training, and more accommodations than ever before. And remember, we're all bringing our own pandemic-related stress and anxiety into the workplace. So we have to provide opportunities for employees to share their challenges and concerns. You'll want to establish really consistent check-ins and ask open-ended questions when you do. So here you'll see some examples of good questions like, how are you feeling about the changes here? What are the most difficult parts? How can we best support you right now? And you'll want to have resources on hand if you hear that an employee is struggling. If you have an EAP or wellness program, encourage employees to reach out and access their assistance. EAPs like ours offer trainings and coaching around stress reduction and managing difficult conversations. Lastly, encourage self-care among your staff. And we've talked quite a bit about self-care being more than maybe what people initially think of when they hear those words. You know, and I really want to reiterate, we're talking about prioritizing wellness here. Drinking water, taking breaks, practicing good sleep hygiene, getting exercise. And of course, again, the best way you can encourage this is by modeling, being mindful of the messages you're sending, both through your own behaviors and through your words. You'll want to be more structured about breaks, making sure they're scheduled and that you have the coverage so that people can actually take them without feeling guilty. Today, we're hearing a lot about the unique challenges faced by families with school-age children. With that in mind, offer flexibility whenever possible and think through a plan of what you'll do if schools unexpectedly close and your staff are scrambling. Northern Light has been working hard to anticipate how potential school closures might impact staff. And just last week, a comprehensive email went out to all employees letting people know the range of temporary solutions in place for the school year, addressing everything from benefits and paid time off to leaves of absence, flexible work schedules, and remote work capacity. We've heard from so many employees that just having this information laid out clearly now has been really invaluable, particularly in the face of so many unknowns. This is a really overwhelming time. So much is outside of our control, both outside and inside of the work environment. So help employees focus on what they can control. We can all be more intentional about how we take care of ourselves. We can be selective with the information we're consuming, limiting sensational news stories and social media. We can be a little more kind to ourselves, recognizing that these are really abnormal times and we're all doing the best that we can. And of course, we can remember that physical distancing requirements and masking protocols don't necessitate social isolation. Let's all reach out to our support networks and help end the stigma around asking for help when we need it. And lastly, let's just try to keep in perspective that this pandemic will one day end, and it will end more quickly when we all work together. Thanks.
Thank you, Yamaya, and I particularly appreciate your closing statement. Next, I'd like to welcome Dr. Jim Jarvis. Not surprisingly, Dr. Jarvis, testing continues to be a hot topic. Businesses want more access to ensure their employees are safe to work. And with the reopening of schools and college campuses across the state, the need for more testing just keeps growing. What information and insights can you share today?
Well, thank you, Karen, and thank you to the rest of our speakers. Inspiring and educational as always. So I'll talk a little bit about testing. I do want to say that some of the things I'm going to talk about today were actually in response to questions from people who have been reaching out to us in between our workshops and asking some questions. And so first and foremost, is talking about testing. The CDC continues to recommend using the rapid test for asymptomatic individuals. So there was a lot of press about the excitement over that rapid test. But using it in a screening process, for example, using it before people come back into school has really been shown to actually give a false sense of security simply because it has a high false negative rate in those people who are asymptomatic but actually have the virus and are contagious. We continue to see that a nationwide shortage of the critical test kits and reagents to run these tests. In some places around the nation, they are seeing 1 to 2 week turnaround time from the time that somebody gets their swab till the time they get their results. We know from a clinical standpoint that anything past 72 hours has very little utility, one, in helping the individual who has the virus, but two, helping to mitigate the spread. And so that's very concerning as we look at area colleges and universities who right now are having all of their students move back into campus, and those in dormitories are often being tested. We do know that here in Maine, our turnaround time for non-clinical testing has gone out to that 72-hour mark or later, and so it's just something for us to consider. It's why we really don't recommend that for K through 12 school that we do screening testing, because it probably will have little utility in helping to prevent that spread. We were asked how long can somebody remain positive even after they have recovered from COVID-19, and we know that they can remain positive for weeks and sometimes months afterwards, which again is another reason why that screening of individuals probably is not something that we should be looking at as a strategy for all industries. I say that because what if you had somebody who was sick a month ago who is completely recovered, is no longer shedding the virus, so can't spread it to anybody, but they test positive? They're going to be asked to then continue to quarantine or stay home when actually they're not a threat. And so that's one of those reasons why we talk about not testing for asymptomatic. So who is testing good for? Well, it is clearly good for clinical scenarios, meaning people who have symptoms. And I know that just this week, the CDC sent out some guidance that is probably going to cause a lot of confusion and consternation across the region. Basically, they said we shouldn't be testing people who don't have symptoms. Many health experts, myself included, do not agree with that particular philosophy. We do think that it is very important to continue to test asymptomatic individuals who have come in close contact with patients who we know are positive for COVID-19, particularly household contacts, or possibly when we're talking about reopening schools, individuals in the same classroom as somebody who tested positive. We know this can help to limit the spread by identifying early on those asymptomatic individuals who have been infected. We've seen that certainly in the Katahdin region over the last few weeks. And then certain high-risk industries. Certainly we are testing people, we are testing staff members in long-term care facilities in order to make sure that we can decrease the amount of virus that's out in those communities simply because the residents of long-term care facilities are highly susceptible. And so we want to make sure we can protect those. Beyond that, testing of asymptomatic individuals is limited. So what should we be doing? So when we're talking about screening, I think we still need to talk about screening. And until there's more rapid availability of those PCR tests, then we just really need to be doing symptom checks. And symptom checks are the best way for us right now to do screening of individuals who are asymptomatic coming into our businesses, into our offices, and back to school. We may or may not want to consider doing temperature taking with that. In the healthcare field, many of us are doing temperature taking. However, it has a downside. There are many reasons why people can have an elevated temperature or even a fever that are unrelated to COVID-19, and trying to determine whether or not that's best to exclude individuals simply because they have an elevated temperature is difficult to consider. So that's why when we talk about doing temperature taking, I mean, in schools, we really don't want anyone who has a febrile illness, whether it's COVID-19, influenza, or the common cold coming into our schools, because we want to make sure everybody else stays well. You may want to simply ask the simple question of, are you feeling unwell today? And if the answer is yes, regardless of what the reasons are that you're feeling unwell, now is the time not to be the hero. Now is not the time to have them return to work or come to school. Now is the time for everybody to stay home when they're not feeling well. If you do want to have a more complete symptom checker, I do recommend that you use the CDC symptom checker, and the link is listed right there. And the reason why we don't list the actual symptoms on our website is because it's ever changing. And so going to an up-to-date source like the CDC is a good way of doing that. And Karen, I'll turn it back over to you because I think we have questions.
We certainly do, and thank you so much, Dr. Jarvis. We are going to focus on questions right now, and I'll do my best to group similar questions together so we can get as much answered as possible this morning. And Dr. Jarvis, I'm going to ask the first question to you. The question is regarding what the current rule is for Mainers who leave and return to the state as it relates to COVID testing.
Yeah, so once again, the CDC this year, the federal CDC made a recommendation this week to drop the quarantine requirements for individuals traveling from outside the country into the United States or from traveling from state to state. Again, another very controversial statement. However, if we read through the entire statement, it finished with, you must follow the state and local guidance in your particular area. So currently in the state of Maine, we are still under a governor's executive order that does require individuals who travel outside the state of Maine and back into the state of Maine, or from another state into the state of Maine, to quarantine for 14 days or to have a test result that is negative, unless they're coming from one of the 5 states that have been listed as exempt. And that list of states has not changed in the last few weeks, and we don't see it changing anytime soon, as we do see that some of the states that are close to our region continue to have a high rate of spread, particularly Massachusetts.
Great, great. I'm going to toss the next question to you as well, Dr. Jarvis, because this one is a timely one. Given the most recent news, can you provide information about the blood plasma as a COVID-19 treatment? And is this something Maine hospitals are equipped for?
That's an excellent question. So actually, yes, Maine hospitals have been participating in some of the studies about using what we call convalescent serum. And basically that's taking from an individual who has been known to be positive for COVID-19, has recovered from the disease, taking their blood and siphoning off the plasma portion of it with the hope that it would have antibodies that we all use to fight infection in high levels, and then giving that plasma to people who are seriously ill. So our two large institutions in the state of Maine have participated in trials for that and continue to do so. With that new guidance that came out and talking about emergency use for convalescent serum, I do believe that the Mayo Clinic trial is being shut down because they will now fall under the emergency use. I will warn people though, emergency use means that they think that there is a possibility this may be helpful. It has not been proven yet. And so there still is some concern about using that as a sole method for treatment. And also that this is going to be the answer to all of our questions and prayers on how we can fight this virus. So still more to come, but yes, it is available in the state of Maine. And there still are some facilities that are actually collecting convalescent plasma from individuals who have had the virus and have recovered. And you can find those on our website.
Great. Thank you so much, Dr. Jarvis. Chris, I'm going to ask you the next question. You had mentioned safety plan in your presentation. Can you give a bit more detail about what a safety plan should or could look like, and how can schools support their staff in the implementation of this plan?
Sure. We are talking so much about this right now with teachers, and I hear educators say, but Chris, I'm an English teacher. I teach math. I don't know how to do a safety plan. And I challenge that you do. And similar to what we talked about with self-care, it really is identifying what the trigger is and what the response to the trigger is. So anyone can sit with a kiddo and just outline what's going on that's making you feel this way, whether it's being teased, whether it's an adult saying no, or whether it's other feelings that kids are bringing into the workplace from everything that's going on around us. And so a good safety plan will always involve the trigger and the response. So what are some coping strategies that kids can do when they're feeling angry or sad or anxious? And that's as much about self-care as anything else. And who to go to for help. Who does the kiddo identify as their go-to adult, whether they're in the school building or remote? And with that comes the challenges of finding access when we're remote to those go-to folks. We've worked with so many kids that their go-to adult at the school is the lunch lady, or they're the lead custodian that they see every day by their lockers and have struck up conversations and relationships with. And so schools are challenged to be creative and provide access to school staff that aren't typically doing Zoom instruction. But I've worked with some great, real innovative schools who are finding ways to do some drop-in hours with those non-traditional school building employees.
That's wonderful, Chris. And if there's anyone that's interested in accessing some assistance with that, would they just reach out to you?
Absolutely. We're happy to do some additional coaching and technical support, as well as provide some templates and some real hands-on worksheets that teachers can do with kids.
Fantastic. Thanks so much, Chris. Suzanne, I'll ask you the next question. What is the recommendation for extended use of face coverings? And perhaps you even need to define what I'm referring to in regards to extended use. And should the cloth face coverings be cleaned between each use?
Yeah, for extended use of a face covering, that's generally referred to as anything more than one day at a time. And ideally, they should be washed in between days. So if, as much as possible, if you're using a cloth face covering, you might want for your children to have one for each day of the week. That way you can make sure that they're cleaned in between uses. Particularly with younger children, washing them more frequently is preferable. The younger a child is, the more likely they are to keep contacting that face mask. They're putting their hands all over it. They're getting the outside of it dirty. So the cleaner you can keep it, the safer that they'll be.
Thank you so much. Yamaya, You noted the importance of asking open-ended questions of employees, such as, how can we best support you? When the answer is something that an employer is not able to accommodate, how do you suggest employers handle this? It's the old adage of, be careful of what you ask for, right? That causes some employers anxiety when it comes to implementing these strategies.
Yeah, thanks for this important question. You know, workers will make requests sometimes that can't be fulfilled. And what I recommend in that situation is to see if you can explore what needs they were hoping to meet through the request. If you can fulfill a need, a worker may be satisfied even if their request is denied. So digging in a little bit and asking those kind of why questions, or is there any other way that we can meet this need, trying to get creative together. You know, and you do want to be careful to not overpromise something without knowing exactly what is going to be acceptable through your company's policies. And there are going to be times when you're just going to have to say something like, I know how important this is to you, and I'm really sorry I'm unable to accommodate your request. And then, you know, follow up and say, if this is presenting a really big problem for you, let's definitely keep in touch about it so neither one of us has too many surprises. And I hope you'll feel free to keep coming to me if you have other ideas of ways we can make this work and we can do some more problem solving together. I know it can be scary to ask these open-ended questions, and it will really create a culture of some more kind of psychological safety that really helps people stay connected and want to make things work, both for themselves and for what needs to get done at work.
Thank you so much, Maya. Dr. Jarvis, next question is for you. Do we know yet if those who have been infected by COVID-19 are immune? I know that that was a little unknown at the beginning of this. And if so, do we have any understanding of for how long?
That's an excellent question, and the answer is we still don't know. However, this week there were 3 reported cases where scientists are pretty confident that someone who had completely recovered from COVID-19 was reinfected with COVID-19. That should continue to make it scary for us as we go on and about our communities, that we really don't feel that anyone is truly immune from this virus at this particular time. The good news that came out of that was that those 3 individuals seemed to have lesser symptoms than they had the first time they were infected. We also know that from the information that came out of the USS Theodore Roosevelt, that several of the shipmen on that, sailors on that ship did recover and then seemed to get sick again. It wasn't clear whether they were reinfected or just that they continued to have a reactivation of their original infection. So there is concern out there. We still are learning, and we still have a lot more to learn.
Thanks, Dr. Jarvis. And as a follow-up to that, we are hearing some reports in the media that the virus is mutating, which could impact the potential effectiveness of a vaccine. Do you have anything to add to that?
So all viruses change a little bit. So when we talk about viruses, we're really talking about genetics. And so all viruses kind of go through a little bit of a change from time to time, and this coronavirus is no different. Right now, the changes that we have seen from when we first started talking about this back in December, January to this time now have not been anything that's caused any dramatic change, and certainly hasn't really changed what we think will be the immune response, particularly as we talk about doing vaccination. In fact, there were other vaccines being prepared to fight coronaviruses in general, and the hope is that this vaccine will actually be able to target more than just the coronavirus that we're dealing with that causes COVID-19. So we're very hopeful in that regard. Now, obviously, any virus has the ability to change dramatically, which is the reason why we have to get a flu shot or an influenza vaccination year after year, because that virus changes on a more regular basis, and when it does, it usually causes a dramatic change in the immune response to that virus, hence the need for annual influenza or flu shots. And of course, we strongly recommend people get them this year because we want to protect everybody from both COVID-19 and influenza. It is a possibility that once we have a safe and effective vaccine against COVID-19, that we may need to get annual ones if the virus were to change or the immune response doesn't last long enough. So be prepared that that might be the case, just like we do for influenza.
Great. And Dr. Jarvis, you may not know the answer to this, but you may know where to direct this participant. We have a participant inquiring about if a family member needs to get a COVID test to go from Maine to Massachusetts.
Yeah, so that's been a challenge for people. There are very few places around the state that are able to do testing for things like travel. I will say that Northern Light Health has partnered with the state of Maine under the state standing order. And so you can call our triage line and talk about that and see if you're eligible for that particular one. And there are some other agencies around the state. Unfortunately, they seem to change because we're all dependent on those critical supplies to be able to do any kind of test, both clinical tests and things for travel. So you may have to call around a little bit before you can find a place that can accommodate you on a timely fashion.
Thank you. And this will probably be our final question, Suzanne, so I'll throw this one to you. During the first few months of COVID, there was a lot of fear that the virus was lurking on surfaces. And at that time, we were all sanitizing our food packaging and quarantining our mail. Can you tell us what we've learned about the transmission of the virus since COVID was first introduced to us?
That's a great question, particularly at the beginning of the school year with all of the papers and forms going home with students and then them coming back into the classroom and what to do with them, very similar to the question about the mail. We have learned a lot. What's more important than the actual surface is what you're doing with your hands after you've contacted them. So, read your mail. You don't need to quarantine your mail, but you should wash your hands after you come into contact with any surface that you're not sure of what possibly could be on it. So after handling cash or your mail or a package, wash your hands and just wipe down the surface. And that's really going to be the most effective, and you're certainly not going through extra steps that you don't need to.
Wonderful. Thanks, Suzanne. And I'm going to squeeze in one more question because I think that this is one of the most important ones. So, Chris, this one's for you. As parents, we're struggling with the decision to keep our kids home, full-time remote, or go to hybrid, as many school districts across the state of Maine are allowing parents to make that decision. And it seems to be a question between physical health or mental health, right? And that's the dilemma we're all facing. So how can parents who are doing partial or full remote learning ensure that their child is not socially isolated?
And see, it's a great question, and it really is a lot of times a no-win. There's not a right or easy answer for those kind of questions. I've been seeing a lot around the country of parents and families who are engaging in educational cohorts, but also that social cohort where they're making a real intentional decision to expand their bubble, and they're doing that very transparently and with a lot of communication and very following guidelines, making sure that they're communicating about risks and that levels of risk are tolerable. But as they expand that decision, as the decision to expand the bubble is made, they're drawing in more natural supports. So they've created maybe a 3 or 4 kid deep play group, study buddies, the ability to have that play date guaranteed to be in your bubble at the end of the school day and get a little bit of a relief. But it's also what I love about the idea is that it also provides a natural support for mom and dad as well, that they have other parents that are now safely in their bubble to be able to lean on, a shoulder to cry on, or somebody who you can say, I know exactly what this feels like. I'm wrestling with this decision too, and I'm scared, I'm nervous. And so I like the idea of really being intentional about your bubble and thinking about ways to keep kids engaged socially while the physical distance mandate is still around them.
Thank you, Chris. It's certainly a dilemma that is weighing at the hearts of many right now. So thank you for that. And thank you all, and thank you panelists. Just a reminder, we will be emailing you a survey right after our conference today. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. Also, to access the resources shared today, visit our webpage. The link will be in the follow-up email that you receive. Starting next month, we are going to transition to bi-weekly Zoom conferences. On Thursday, September 10th, we will focus on the importance of accessing preventative care for your employees, including where and how to get access to flu vaccines, the value of having primary care or pediatric provider, and how to maintain mental health wellness. And on Thursday, September 24th, we'll give the latest update on COVID-19, including tips on safe travel or working in the field, and how to have group meetings when technology isn't an option. We will send you the registration link for both weeks and hope you will consider joining us. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you for joining us and have a wonderful afternoon. Take care.